Okay, awesome. Hi, everyone. Welcome to Women of Color Remake Wellness Sunday Wellness discussion on destigmatizing mental health discussion in BIPOC communities, and BIPOC standing for Black, Indigenous, and People of Color communities. My name is Meenakshi Sharma. I am from the Lotus Movement, and today's session, we've actually joined forces with the Women of Color Remake Wellness organization to host this discussion for all of you today. So thank you all for tuning in and joining this really important conversation. So today we have a panel discussion, and I'm going to introduce the panelists shortly. I'm just going to go over a few housekeeping. It sounds weird. This is a virtual event, but I'm still gonna call it housekeeping. So the intention is to go for till about 8:30 with an open discussion at the end. So from 8:30 till 9, we'll accept. Sorry, I'm just admitting people into the session as well. We'll go through any of the questions that you might have. Feel free to send in your questions throughout the discussion as well. You can use the chat function, and we'll be sure to keep note of the questions coming in, and we'll address those at the end. So at the beginning, we'll be going through a series of questions that we've come up with, and we'll be asking our panelists to chime in and answer and provide their perspectives on. So let's get right into it. So I want to introduce our first panelist. Her name is Jaspreet. She is an experienced commercial banker and holds an MBA from the University of Gulf, specializing in sustainable commerce. She is a mental health advocate and is very passionate about community involvement. Currently, she is involved in numerous initiatives with the Royal Ottawa Foundation for Mental Health. Secondly, we have Chaudhry, who is a psychotherapist qualifying with the College of Registered Psychotherapists of Ontario. She holds a Master's of Arts in Counseling Psychology and has acquired additional training in cognitive behavioral therapy, dialectical behavioral therapy, acceptance and commitment therapy, and emotion-focused therapy. Sana's private practice is called Life Cycle Counseling, where she provides therapy for individual therapy needs such as anxiety, depression, grief, trauma, infertility, fertility counseling, and prenatal pregnancy and postpartum therapy. So welcome, Sana. Samiyah Zawawi, tell me if I pronounced that correctly. Yes, okay, good, thank you. She is a psychotherapist. She holds a master's degree in educational counseling and a bachelor's degree in psychology from the University of Ottawa. Samiyah provides counseling in English, Arabic, and Spanish to adults and youth in both individual and group settings. She has extensive experience working with refugees and newcomers, as well as individuals who have experienced trauma, anxiety-related challenges, depression, identity loss, migration, grief, and attachment-based issues. Samiyah works collaboratively with clients from diverse populations and draws from her own lived experiences and cultural understandings. So welcome, Samiyah. Nereah Felix is a registered psychotherapist qualifying and co-owner of a mental health private practice called Catharsis Counseling and Psychotherapy. She will be starting her doctorate degree in clinical psychology in the fall. She supports adolescents, adults, and couples on their journey towards mental and relational well-being. She primarily works with presenting concerns such as anxiety, depression, self-esteem, and trauma. She is passionate about the field of mental health, especially as it pertains to the BIPOC community, and is looking forward to contributing in any way she can. So welcome, Nereah.
Hi.
Awesome. So these are our 4 panelists for today. I can't forget Beatrice, who is the founder of Women of Color Remake Wellness, the organization. And I just want to take a few minutes to share what the Lotus Movement is about. We are a mental health organization working on demystifying the stigma on mental health within the South Asian community, but also uniting with other marginalized communities to address the stigma there. So thank you all again for joining this conversation, and let's get right into the questions. So panelists, I'm going to ask the question, and feel free to just flag me if you'd like to go ahead and answer the question. So question number 1, what do you wish more BIPOC communities and or individuals understood about mental health or therapy? Yeah, go for it.
I think the biggest struggle I've seen so far is people thinking that asking for help is a form of weakness. And I've seen this for many different clients. And I wish it didn't feel that way, that kind of, that asking for help somehow causes them to be less valuable or less self-sufficient or self-reliant. I think that's one of the biggest things where it's like, yes, you could do things on your own, but relying and depending on other people and getting support from other people is not necessarily a form of weakness. But of course, this is influenced by, family of origin, trauma. So there's a lot of fear around relying and depending on others and what that means for them. But that's the biggest thing I would see.
Absolutely. And that's a good point because we do see that from, I guess, from generational, trauma and issues, because there's always this expectation to always deliver, and you can't fail, and you can't ask for support or help. So thank you. Did anyone else want to chime in? Yes, Sana, go ahead.
I'd just like to add, I think education surrounding mental health is very, very different as it varies through cultures. So for instance, particularly the clientele that I see, South Asian clients, one, they're not even aware that there are BIPOC therapists available. And so oftentimes when they do find me, I'm sort of able to let them know, you can go on to Psychology Today, good therapy. But again, we're so minimal in our numbers. Like there's such a small handful of us. So that's one thing. But speaking primarily to the education around mental health, these clients that I do see, oftentimes they associate mental health or mental illness to just schizophrenia or bipolar disorder. They do not think of anxiety and depression as a mental health disorder. So therefore they feel that, well, this must be just an issue with my thoughts or my behavior. Particularly within the Islamic Pakistani culture, because religion is also tied into that. A lot of times my clientele will tell me that, whenever we do seek help, a lot of people will tell them, well, you're spiritual. And yes, within the therapy world, we recognize spirituality to be a protective factor. And while that is, I don't think that it's beneficial to tell our clients that, oh, well, you're being ungrateful to God, or if you just pray, God will fix your depression and anxiety. And that's oftentimes, unfortunately, what they end up hearing. So I do think that there's a different kind of, we maybe need to advocate and educate people a little bit more in terms of what mental health means, and recognize that mental health is very, very different in terms of its meaning in different cultures.
Absolutely. Yeah, Samiyah, go ahead.
I think just adding to that, what Asana, you said, I think it's really important to also, mention that the BIPOC communities, they have so much to navigate, right? There's so many multiple identities that they need to navigate, and a part of their mental health is impacted by so many different factors that it's just not one thing. It's a lot of multi-layered, including racism, including intergenerational trauma, including socioeconomic status, culture, religion. All these play a very big role. And I think it's important to kind of what Sana was, to educate people on that as well.
Jaspreet, go ahead.
One of the things that I think also really sets it back in the communities is reputational risk, you can almost say. And I know, Sana, you probably see this with your South Asian clients as well. It's the sense of pride, and it goes in hand with weakness as well. Speaking about how you're emotionally feeling and mentally feeling really takes away from pride, and talking about it openly, people finding out that someone is feeling that way, I think plays a huge role. I've seen in the Sikh community, in other South Asian communities that I've been associated with. I think that's a big thing as well. So really, I mean, education, like Sana said, and as Nereah said, the sign of weakness, that would really help take away from that. And breaking that whole idea of reputation, and that what people think doesn't really matter, because if you within aren't okay, then the reputation doesn't really matter much. But it plays a big role in communities that I've been involved in.
That's a really good point. And I'm going to kind of, I know, I'm so sorry I'm going to do this. I'm going to ask a question because it just popped into my mind. But, you know, there's a common theme here about education, but how do we provide this education in our communities? Because sometimes there's also that reluctance to even educate ourselves about mental health and how we can get help. So what are some strategies that we could, you know, use to educate our communities? Yeah, Jessie, go ahead.
So I can give my personal example. Just having had, I have a 1-year-old son, and just having gone through my pregnancy and postpartum difficulties, one of the strategies that I'm personally using is just trying to get my loved ones who struggle with understanding mental health involved in initiatives such as Lotus, talking to them about it. I've had conversations with my family, my husband's family, about what I've been feeling, what the sort of the stigma is, and them really being open to listening. But I sense that hesitation as well. And I was actually having this conversation with someone today. It's up to, like, I'm first generation Canadian, right? And luckily, like, born in this country, we have a lot of the knowledge, a lot of the education, but it's up to us to break that sort of stigma within our generation. So at least the biggest problem for us, for me, lies in people that are in older generations from where I am. So when they see us doing this, then they can sort of, even though they may not fully accept it, someone may be listening to me right now and be like, why is she openly talking about the things that she's talking about, and feel uncomfortable. But that's a sense of uncomfortable that needs to happen. So going forward, if we are uncomfortable and we have these conversations, generations to come will not. And even though I'm not in no means am I a health professional to be talking about this sort of stuff, but to educate that way, sort of by just raising awareness, I think is number one.
For sure. Yeah, Samiyah, go ahead.
Just adding on to that, I think that it's really also, and this might come up in like more conversations as this gets going, but I think that creating safer spaces is really important. Oftentimes we don't have that, right? And there's a lot of judgment around so many different aspects. And if we don't have those, if those safer spaces are not created within the BIPOC communities as well as like other communities, it becomes really harder to educate. It becomes harder to have conversations about it. So I think that creating these safer spaces are really, really crucial and important to be able to keep the conversations going.
Yeah, Sana, go ahead.
And I'd just like to add to that point, I think one way that we could increase that is particularly in primary care. And again, I'll probably touch on this later, but using our language interpreters way more. Like we underuse them in our society, and we need to start using them, particularly for newcomers and particularly for the BIPOC community who may not understand English as their first language. Tying that in with like, whether they're at the hospital or even just their family physician, and oftentimes recognizing the culture that they're coming in, particularly speaking to primary healthcare workers, recognizing that their culture that they're coming in from, they may be presenting signs of physical symptoms that are actually coming from their anxiety and or depression. And that kind of goes misdiagnosed because they're so fixated on the physical symptoms that they associate that being the reason to go seek care in the first place. They don't even think that, well, if I'm experiencing mental health issues, I should go seek care. So I think there's like a bit of a gap there.
Yeah, Nereah, go ahead.
And I think, especially as therapists, I feel like there's a lot of opportunity to collaborate with already established community organizations that cater to particular populations, and to even have that sense of providing kind of like, whether it's like hour-long workshops surrounding certain issues or concerns. And I know people tune into social media platforms quite a bit, whether it's like an Instagram post about mental health or like a Facebook post. So having that ongoing conversation. And I think that even collaborating with people who are not part of the BIPOC community is very important, because sometimes they do have larger platforms, and sometimes they do encounter issues with racialized people just in general, and they could always, as long as that as long as they know there are BIPOC therapists and community organizations that could help support, they then know where to send their clients if they ever need to. So I think there's a lot of opportunity there to collaborate on such a community level. And I think it's important to take advantage of those opportunities as well.
Yeah, Jessie, go ahead.
To add to what Nereah is saying is, for social media, a lot of our, like for me at least, or older generations don't really use social media. They don't have Facebook. Well, a lot of them have Facebook now, but like don't have like Instagram, or like don't use social media as much. So reaching out to like radio shows, like South Asian radio shows, or different types of things that they sort of trust in, or like TV shows, or like different avenues where they believe, because sometimes even though like you're a professional in a certain sense, but your like grandparents or your parents may still believe something that they see on TV or hear on the radio more versus what you're telling them. To get those types of organizations involved and start raising conversations there, so it's more openly spoken about, would really help spur some conversation and educate.
Absolutely. And what I hear from that too, like just kind of summarizing, is that like there should be a sense of community and working together and building that unity. So that's why I'm so happy that this event is happening, you know, this evening. And I hope future events do happen where we can bring the communities together and have open dialogue, and hopefully invite more of our family and friends too, right? Like I know it's hard to get people to realize the, you know, the importance of having these discussions. But one thing I always like to say is that you yourself may not be experiencing like a mental health issue or an illness, but you never know who within like your arm's reach might. And it's always so imperative to have the right resources on hand, to know where to reach out to guide them, to be a support. So so collectively doing this together and bringing communities together is definitely key. So thank you all for answering my detour question. Okay, so I'm going to move on to question number 2. And this is, what are some challenges you've noticed in BIPOC communities as it pertains to mental health? Senna, go ahead.
Okay. So as I kind of mentioned, language barrier is probably a really big one. I know one of the most researched barriers is also failure to use interpreters, as I kind of mentioned. And I also think that accessibility to mental health services, particularly within Canada, I know that OHIP covers a lot of services, but unfortunately, mental health is still very, very underfunded. So recognizing that particularly for BIPOC communities, oftentimes their basic Maslow's hierarchy of needs are just being met, like just barely, let alone then thinking one step further, okay, now I have to worry about my mental health. How am I going to make my ends meet? Getting the time. They might be working hour-long days, and then to fit in mental health and recognize those symptoms, and then lack of education around that. There's a lot of stuff that kind of plays into this. And then that coupled with the fact that psychological services and psychological service providers are still predominantly Caucasian. There's not a lot of BIPOC community members there. Helpline and crisis lines are still predominantly Caucasian. And so when there are people in crisis, or when there are people who are trying to reach out to the so-called free services, they're being connected now to someone who is predominantly Caucasian and may not understand their cultural background, may not understand the whole crisis altogether, nor can they contextualize their experience. And so I think as we sort of move forward, it would be really helpful if more BIPOC community members, whether we're therapists within the psychological world trying to fill in this gap and trying to move forward, or if we're volunteers like mental health advocates, taking those courses and kind of volunteering to be even on the crisis lines, I think that's where we need to be.
Thank you for that. Anyone want to add anything to Samiyah? Yeah, go ahead.
I just want to add that I think that it's also really important to acknowledge that it is systemic too, right? There might be in expressing how they're feeling or some of the challenges they're going through mental health. there are some losses, there are some consequences, whether that's at work, whether that's personal, whether that's in community. If we start talking about it, what are people going to say? Maybe in community. If we at work, if I start to express myself that I'm experiencing low moods, is there a consequence to that? Am I going to lose a job? Am I not going to get a promotion? Am I not? It is also very systemic, and I think that it's really important to acknowledge that and have conversations around it, because it does exist.
Absolutely. And I think that, does anyone else want to add anything to, yeah, Nereah, go ahead.
And this is a bit of a different point, but I know that some of my BIPOC clients who have gone and sought out help or therapy, just like Sana said, they're usually connected with, let's say, Caucasian therapists, and oftentimes there's this almost like this underlying pressure to stick with the therapist, no matter if it's working or not. And I feel like a lot of people find trouble speaking up. A lot of clients find trouble speaking up and saying, this isn't working for me, because of just like the power dynamic that is there sometimes. So I just know that it's something that they struggle with, especially with sitting sometimes, and this is for some clients where it's really difficult for them to feel comfortable opening up and sharing parts of their experience, especially if they feel like it's going to be dismissed or misunderstood, and they don't feel kind of like putting that effort into like explaining where they're coming from. So it's easier for them to connect with someone who's from their specific community. And that's one of the concerns I've run into quite a bit in terms of BIPOC clients.
And that's a good point. Oh yeah, Jessie, go ahead.
I just wanted to add to that, because I personally have experienced something similar where, I've known people who have met with therapists, and I personally have met with a therapist who just really didn't understand my background or whomever I've spoken to, their background and where they come from, and have offered solutions that aren't in line with what their values are. So what I would say is, like, when like therapists themselves or mental health advocates like me, we need to educate ourselves, not only with whatever background we're associated with, but also with other community backgrounds, because we live in Canada. It's a multicultural country. We've got everything here, and it's so important to be well versed, especially in this profession, because there's so many different challenges that come to play. I mean, for someone like myself who lives in a joint family, going to talking to a Caucasian therapist, for them, that's going to be like, they're going to think I'm crazy, right? They'd be like, what's wrong with you? But if I talk to a South Asian therapist, they would understand, right? So challenges like that, I think it's important in the field for people to be more versed on different cultures and different backgrounds and different struggles that can come depending on what culture and background you're from.
Absolutely. Yeah, Sana, go ahead.
Another challenge that I've noticed, now that you guys have actually brought this up, is particularly with my counterpart therapists who are Caucasian. It is very difficult to sort of advocate for BIPOC communities and to even talk about like the disparities and talk about the challenges faced within mental health, because although they like, a certain part of them, I guess, feels that, well, we have so many colored friends, and so we can understand your challenges and stuff, and so why can I not take on a BIPOC client? There's that fail to recognize that, you know, that connection that's built with another human being because you are from a similar culture, or because you do understand some of the challenges that you've gone through. So I find, for me personally, it's very difficult for me to even ask, or I guess I fail to understand why a lot of my counterpart therapists don't feel comfortable referring their BIPOC community clients out to other BIPOC community therapists. And I feel like we're working twice as hard trying to advertise ourselves and put ourselves out there, but there's still so many members from our communities that end up going into or seeking counseling and getting counseling from Caucasian therapists, and they're just not willing to sort of put that out there. This is obviously not speaking to everybody, because I do have some colleagues who they're very, very open. They're very great with referring out, but I do feel like we need to become a little bit more accepting of recognizing within ourselves that, hey, maybe there's a bias here, or maybe there's something that I don't understand. This is probably not a good client for me to take on. I should refer them out.
That's a really interesting point too. And I personally didn't even think of that. And I'm also thinking to my own personal experience of therapy. And sometimes like I find that when you are speaking to, you know, someone outside of your culture, it also like you almost have to re-explain everything, and I find that takes a lot of time in building that connection. And they say like having a connection with your therapist is key. Like that's what's going to help help you with managing whatever you're going there for. But sometimes I find it's a spinning the wheel sort of concept, and we don't actually get to like the root of what needs to be addressed. So very interesting perspective there, Senna. Thank you for bringing that up. Did anyone else want to add anything? And actually my next question kind of ties in nicely to this one. So maybe I'll go ahead with question number 3. How can we address the stigmatization of mental health in BIPOC communities? No takers. Oh, good.
I have a point. Sorry, I don't want to be making points on each panel, but so for this, I think like the biggest thing that comes to mind that I've actually seen a lot of my clients tell me is they prefer using terms like BIPOC and being recognized as Black, Indigenous, or people of color versus being called marginalized and minority. They feel like right off the bat, we're thrown into this power and hierarchy role when we're referred to as marginalized, when we're referred to minority, and particularly speaking within like a psychology background, when we think of those terms, we actually look for meanings behind it. So we associate, we look for things that we're going to associate meanings to, right? Like we label things and then we associate meaning to them. So if we're associating minority and marginalized terms with BIPOC, right off the bat, there's a problem there. There's a huge gap there that needs to be filled and changed. And so I think just changing that role and changing that dynamic by calling us like Black, Indigenous, people of color, labeling us as who we are and calling us as who we are, similarly how we call ourselves female or male or Miss or Mr. or whatever it may be, we kind of are able to feel more comfortable in that role. And that's been something that's been brought time and time up with my BIPOC clients. I thought I would just share that.
Interesting. Thank you for sharing that. Anyone else want to add anything to this question? Oh, Nereah, yeah.
I think as with anything, I mean, stigma is kind of like a mark of disgrace associated with like a person, a quality, or a circumstance. And I think opening up conversation about just this is just very important. And I think there are communities within the BIPOC community, whether it's like, the LGBTQ, or I don't, excuse me for not knowing the actual letters that are part of it right now, but I know even within that community, like that's a specific, identity, and opening up conversation, because they do have a lot of, stigma associated with mental health as well, and targeting, student BIPOC population. Like there's so many subpopulations within the BIPOC community that I feel need a sense of recognition, or need a sense of support. So opening up of conversation just surrounding this. And I think conversation is always so important. And I feel like, we ourselves, even though as therapists, people don't necessarily feel comfortable opening up about, their own experiences and their own struggles, but I feel like that could potentially add another human element to it as well, where it's like, yeah, I've had difficulties with this, and maybe even having more of an honest conversation as to what that's look like for ourselves. Because I feel like people often think that, oh, therapists don't have problems, like they know all the solutions, so their lives can't be difficult. And I feel like that's the biggest lie in the world. So I think conversation is always like a really, really good place to start.
Mm-hmm. Yeah, Samiyah, go ahead.
I just want to add to that, in talking about having conversations, I think it's really important to point out that where we have them and who we have them with is really important, because we can be placed in really vulnerable spaces if it's not safe enough to do so, right? And I'm looking at social media platforms, and it's great. There's so much knowledge there. There's so many different, Instagram accounts, Facebook accounts that really want to talk about mental health and have conversations about it. But with that also comes a lot of maybe some concerns, right? Because there's a huge bunch of population that are, you don't know who they are or what their thoughts and processes are. And so who you have these conversations with, where you have them is really important. There is a cancel culture in social media as well, and it doesn't create safe spaces for us to have any forms of conversation. And some people may not even be ready to have these conversations or or talk openly about it. So looking at different ways to get some knowledge around it could be really helpful, like different podcasts, different resources, books, just as a starter way to understand it better, and then maybe get in closer to either seeking therapy, seeking support, or even starting to talk about some of the things that they're going through.
Mm-hmm. And that's such a good point that you bring up about social media, because that's something that we've kind of spoken about in our own Lotus team as well, that we have to be very mindful of what we're posting and what we're sharing, because as much as we might think it might be helpful, it could potentially be triggering to others. So as much as, yes, there's a lot of resources out there, there's a lot of social media platforms, like you've mentioned, that are, and not doing it in a malicious way or anything, but they are trying to be helpful, but just mindful. I think mindful is definitely the lens to put on there. Sada, did you want to add something? I feel like you had your hand up, or just
oh no, sorry, I was probably just
okay.
Sorry.
Okay, go ahead.
I wanted to just talk about the term mental health and the stigma associated with just the term mental health. Like some of these ladies mentioned earlier, that a lot of people who don't really have that education associated with like schizophrenia, bipolar disorder, like the really severe mental illnesses, is where they sort of think that you need to, is when you need to see a therapist or a psychiatrist and get help. But I think having opening conversation about what does mental health actually mean, like what is depression, what are the levels of depression, like actually, like what is anxiety, how is it detrimental to your health and your loved ones, is really important. Because I've seen people who need help, but they're scared to approach their doctor. They're scared to approach anybody about it because they're scared that they're like, oh well, I'm not like, and I'm just translating what this was said in a different language, is I'm not crazy, there's not really that, it's not that serious, I'm just feeling a bit unwell inside. So I think really, like when you look like at least with the South Asian community and with people who aren't that well versed in terms of education wise or in mental health, they don't really know how severe something needs to be, or how like what the early stages are. So they're afraid to approach someone to talk about it until it gets really bad.
Yeah.
Like we've seen cases of someone committing suicide in I know multiple cases where someone's gone to lengths of committing suicide, but and before that they just weren't able to talk to anybody about it.
Yeah.
So it can get quite.
Absolutely. Yeah. Samiyah, go ahead.
I just want to add to that, just when you said, how do people understand mental health? The word mental health, in different cultures, or the way that it's translated to, can mean it has such a different connotation, right? And this just reminded me of when I first started working with refugee clients or immigrants, and just the word mental health, the minute you present it, there's a shutdown. There's like, nope, we're not going to discuss this. We're not going to talk about this. And maybe the wording around it needs to change, and understanding how different communities, different cultures really, the translation of mental health, right? Well-being sometimes was used, or I used well-being as a way to get them to maybe possibly feel safer enough to have conversations. It's less, I want to put it in quotations, threatening than mental health for some communities and some cultures. And so the word itself, how it translates is very different for different cultures. All right, so I wonder whether that plays a role as well.
For sure. And I can attest to that actually, because like growing up in a family where mental health was never spoken about openly, but only joining the workforce and hearing more about like mainstream mental health campaigns as well, like, you know, Bell Let's Talk. Now I feel like I'm comfortable enough to say the word mental health. But you're absolutely, you know, that's such a valid point that in cultures, it's just mental health is like you put in air quotes, is a threat. So so very, very good point there. Okay, great. So maybe we'll move on to the next question. How can health professionals recognize and appropriately treat mental health problems in BIPOC communities or individuals, particularly among new immigrants and refugees? I think, Samiyah, we're all looking at you.
I think one of the main points possibly is to believe them, right? Especially with refugees or immigrants, you hear the research or you hear news, they're always talked about in numbers, you know, 60%, 20%, 15% have left their countries, Syria, Iraq, etc. And they don't really, we don't have the face behind those numbers. And believing them, believing their story is really important. It's important to acknowledge that, that their narratives do exist, that they have a voice, right? Validating them, because oftentimes in so many different settings, I've heard people in the mental health field say things like they're coming in, they just want their papers, or I don't believe that this is, you know, that they're telling the truth and things like that, right? And even that in just being able to validate, acknowledge, and listen and believing their narratives is already therapeutic in itself. Right. For the first time, you've had someone actually believe what they're saying when oftentimes they might be dismissed.
That's powerful. It's very powerful. Did anyone else want to? Yep, Nereah, go ahead.
And I guess this is speaking to a specific part, but I feel like there needs to be more of a recognition surrounding like race-based trauma and understanding the effects of racism and discrimination in people's narratives or contexts. And I feel like it's something that's quite easy to almost discount sometimes, where it's like, oh, like, are you sure this was about your race? Like, are you sure that came into play when you were experiencing this thing? And it's something I've heard a lot of people go through. And I feel like that's super important, because the world is the world is always reacting to you based on different aspects of your identity. So to completely discount someone else's experience, especially as it pertains to their own, you know, racial identity, could be quite harmful in the therapeutic relationship. So, and racial trauma is something that's been researched more frequently now, specifically around the PTSD symptoms surrounding that. But I feel like it could come up. I've worked with a lot of clients when it's come up to like, we've addressed how, you know, social anxiety could be based on, you know, I'm a Black person and in white spaces, like, I really don't feel comfortable because there's certain aspects of my identity that I feel like I have to hide or conceal because people are going to judge me negatively based on that. So I feel like race and identity plays a role in people's experiences of the world. So making room for that in a safe and secure way is very, very important, and it can be crucial or important to the therapeutic relationship and alliance building.
For sure. And especially if someone whose, you know, first language isn't even English, right? Like, just imagine, I'm sure there's a lot of social anxiety that's built up there. And even as a child, like, you know, growing up, like Jessie was saying, like, grow up as a first generation Canadian, there's a lot of differences in when, you know, at home versus going to school and, you know, immersing yourself in the school environment, in the Western culture, I'll say. You know, sometimes there is a bit of anxiety with, you know, the way that we look, the way that we dress, the way that we say things. And sometimes you have experiences in your childhood that build up that social anxiety that you don't realize until much later on. So so that's a really, really good point, Nereah. Thank you. Sana, go ahead. Oh, you're muted there.
Sorry, guys. I just wanted to add, I also think like there's a lot of rules, particularly pertaining to us being therapists, on how we treat clients. So for instance, like rules around confidentiality and disclosure, I think we need to look into them in more of a cultural context. So for instance, oftentimes, I know within my college, like the CRPO, we're supposed to receive a referral directly from the person, but oftentimes because of language and whatnot, a brother or sister might be reaching out to me, a parent might be reaching out to me for their child or whatnot, just kind of asking about the services. And we sort of run into a bit of an issue here where the CRPO on one hand is saying, no, speak directly to the client, and or issues where, you know, maybe the parent wants to be in the room with their child to also understand the issue, to also kind of understand what mental health is about and stuff. And we're sort of then required to separate that and make it individual. So I think there's a lot of rulings that also, not necessarily outdated, but maybe need to be adapted a little bit more to fit cultural backgrounds. And I also, another thing that comes to mind as a therapist, when I look at treating, offering treatment for BIPOC communities, I think offering like a sliding scale fee is really, really helpful. I know a lot of therapists don't like to do that because obviously it's like income in, income out, but I do think that offering sliding scale fees we can make ourselves a little bit more accessible financially for BIPOC community members.
Yeah, that's a good point. Yeah, Samiyah, go ahead.
I just want to add to that, that piece of the rules and regulations of CRPO. I really think that fundamentally it's education, right? I can't speak for the other ladies here, but when I did my master's in educational counseling, there was really zero conversations about different communities, about cultures, about like religion, all of that stuff that are, you know, on the ground. You see them 24/7. This is Canada, it's very multicultural. And I think it really needs to start there. Like I think there's the educational piece of training is lacking, right? And a big part of the way that, you know, what I've noticed too in working with immigrants and refugees is advocating is a really big role that you weren't taught in university. That, you know, you think you're going in and you're taught to be a psychotherapist. This is talk therapy. Come sit in, you talk, and that's it, right? And then when you're on the ground, there's other parts as well, like advocating for the clients, that plays such an important role when it comes to maybe they're not knowing how to navigate the system. The language is very different. The system, the medical healthcare system is so very different than their countries, and they're being taken from one place to the next constantly, right? And that's not told at all. And even the trainings that are being provided right now, if you look at, you know, professional development, etc., it's very limited. It's very, very limited. You were constantly trying to search, and you find some, but it's and when you do find them, it's the constant kind of similar trainings that always shows up, where I'm going to say cultural competency or diversity. It's kind of the main title that you hear, right? So I do think fundamentally education is really, really important, and that needs to happen there.
So I have another detour question, and I'm sorry for for going off route, but this kind of just popped into my mind again. But how do we, because I'm sure we can understand that, you know, refugees, new immigrants coming to Canada don't necessarily have the financial means to get the necessary help that they might need. How are we addressing this? How are we making sure that they are being looked after, or they are getting referred to, you know, the right places for help? Is that a loaded question? I'm so sorry if it is. Jesse, yeah. Oh, sorry. Yeah.
I think one of the biggest things would be educating, even though they're very educated, are the family doctors and medical doctors in terms of when someone needs to be referred and the kind of issues that they face when they're new immigrants, refugees, and cultural impact that it has on someone when they move into a different country. I'm saying this because I've moved around a lot and I've had many different family doctors, and having myself experience different situations in my own life, and having talked to a family doctor, and noticing how each one approached everything differently and suggested various things, having worked in different corporations as well, because even though like sometimes, a lot of times immigrants come on like a work visa, they're hired by like different companies, and the workplace as well, like having that ability to offer a wellness program, I would be, I think, a first step as well. But I think education of professionals and realization of difficulties for them would be key in this.
Absolutely. I think the angle that I was, and I'm so sorry if this is a really loaded question, and but I think the angle I was trying to think about is, let's say, you know, someone is a refugee to Canada and doesn't necessarily have a family doctor right away, or even like, I think it was Beatrice I was having a conversation with about, is the referral system, I think, is also not working maybe to its full potential, because hearing from peers that if they have like, you know, a Caucasian female doctor or male doctor, and they're expressing as a person of color or a Black or an Indigenous person expressing that, you know, they're feeling such and such symptoms, sometimes they get kind of brushed off that, oh, it's probably, you're probably adjusting to, you know, whatever scenario or situation. I've actually experienced that with my own post when I had to visit my OB after 6 weeks, you know, and I expressed that I was feeling anxiety and whatnot, and it just felt like it was very dismissed. So that's where I'm kind of wondering, like, how do we address this, and how do we move away from this maybe dated referral system that's not actually benefiting anyone, any person of color? Yeah, no, go ahead.
I'll say something around that. I think that if we're talking in terms of my role as a counselor, as a psychotherapist, I do hold a privilege there, right? I speak the language. I'm able to say and use my degree and say, hey, I'm a psychotherapist working with this client, and somehow that scares them a little bit, right? And I use that, and it's very flawed, the system. I can't really give you an answer. I'm like, we need to do 1, 2, 3, 4, 5, because it's almost like we need to clean it up completely and then reconstruct it. But with whatever I can play a role in, I try. Right. So the privilege that I have, I will try to advocate. I also really know the system well. You know, I know if I'm talking to a family doctor, and I know how they navigate, and I know what they're thinking. So there's a lot of creativity involved in how do I get what my client needs and what's in their best interest, right? And the advocating piece, sometimes like going really hard on them, does not help the client at all. Like that might actually not get them to service. So I also try to really be creative in the way that I navigate the system that I'm more familiar with and my client may not be.
Thank you. Did anyone else want to add something? Yeah, Sana, go ahead.
I also think like our system, so for instance, when newcomers do come into Canada, the immigration process, I know that there is medical history that's looked at. But again, I think it pertains just to physical symptoms, physical illnesses. I don't think there's any kind of tool in there in place to assess for mental health. And I think that's something that we can either advocate for, and something that should really be added. I think that it's really important to do a psychological, maybe not a full-on psychological assessment for hours and hours, but some kind of mental health assessment, keeping in mind that, you know, these newcomers, they're facing issues with migration, immigration, adaptation, resettlement, language, all of this kind of plays. And I think with that, again, like the role of language and interpreters would be ideal to have someone who's able and capable of doing those mental health assessments on the spot. So I think like we just need to prioritize it as much as we prioritize these physical exams.
Yeah, absolutely. Did anyone? Yeah, Nereah, go ahead.
I don't know if this is going to address what your question asked directly, but I think especially what Samiyah was talking about, the advocating, I think part of that is collaboration as well. And I feel like, especially as psychotherapists, we could form very important relationships with other health professionals and just other professionals generally. And this includes, you know, lawyers, paralegals, you know, doctors, nurses, like we could, social workers, there's so many people we could form very important relationships with and have conversations surrounding, okay, what have you seen? What have I seen? And what needs work? And how could we potentially advocate together or join forces to create something or do something to address what's going on? And I think that's what I enjoy about the field itself, is just like you can literally collaborate with like construction workers if you wanted to. It's important to, I guess, have that kind of interprofessional approach to helping clients, instead of just feeling like you have to be the person to address every single aspect of their wellness.
That's a really good perspective, that, yeah, just open up that bubble and collaborate. Yeah. Yes, Samiyah, go ahead.
Like what you just said, Nereah, like the idea of collaboration is the idea. I think collaboration itself is really important, and being able, sometimes it's really difficult because we might have very different perspectives and views, but you know, I've often seen, you know, on the other side of what Sana was saying, I've often seen immigrants or refugees being forced to get services for mental health, especially refugees, right? So they come in from, you know, Syria, Iraq, they've gone through a lot of challenges, they've witnessed the war, etc. And they come in, and because they have that story, the sponsors or the family doctors or lawyers are like, you need to go see a mental health clinician, right? But before that, we need to look at just like the basic living. And also we need to look at how they feel about going to see a counselor, and being forced in those situations because they feel like they can't communicate, because they don't have the language. And it kind of does the opposite effect, right? We are actually creating the same narrative of this stigmatize of mental health, and I shouldn't be going. And that is, it's a very, like a very gray area. It's really hard. But I think that collaborative piece is really important to be able to have those conversations with them, be like, okay, we both want the best for the client. You and I are going in the same direction. We're going at it differently. How can we come together to make sure that we're on the same page so the client can also get support, right? Because at the end of the day, I think that we both want the same thing, but how you want to go about it and how I think it might be helpful for the client, that's the part that we need to look at.
Yes, yeah, go ahead.
Going back to, I would like to talk a little bit about how we sort of approach this at the bank. When I was in personal banking, the bank had realized that you're living in Canada, there's lots of immigrants coming in. The bank actually created programs for new immigrants, refugees, or international clients. So taking that approach and looking at this situation, I think it would be something to explore with either therapists or with family doctors, where they know someone's new to the country, what sort of approach needs to be taken. They're gonna go through this and this difficulty. Like we at the bank look at, okay, well, this person just came into the country, they don't have any credit. The credit history that they're gonna have is from so and so country. They don't have, I mean, their only money that they really have is what they're bringing in that currency from that country, which calculates to what this number in this country, right? So really playing in those factors and then evaluating what the customer would need. Putting a mental health sort of spin on it and looking at it from like, when someone comes into the country, they go see their first healthcare provider, and that healthcare provider, knowing that this person's new to the country, they're adjusting to a new country. They're probably facing, I mean, racism is it's still, I mean, alive, and we all know that. They're gonna face certain issues in that, and really looking at it holistically, maybe bringing in a therapist to sort of use like a partnered approach to help someone sort of get their way comfortable into the country would be an approach that could be looked at. And I mean, it's not like reinventing the wheel. It's done in other like in banking, in other organizations, you can say. Mm-hmm. So I think that would be a good way to sort of look at it if someone is willing to bring this to the system and make that change.
Absolutely. It's like thinking outside the box, right? Like how can we help those individuals? So I love it. That's amazing. Thank you all for sharing. So I'm going to move on to the next question. How can healthcare providers identify risk factors and strategies in the approach to mental health assessment and treatment of common mental health problems in primary care as it pertains to the BIPOC community and or individuals? Sana, go ahead.
So I think like right off the bat, recognizing that most patients in primary care or most patients that go in to see their family physician and might be presenting with mental health problems, they actually come in with physical complaints. And so again, going back to that whole thing of this can lead to under recognition and treatment of common mental health disorders. I think that people with depression and anxiety particularly sometimes focus a lot on the physical symptoms or use culture specific bodily sensations to express distress. I also think that sometimes people are very reluctant to reveal to their physicians because they think that, well, maybe the stressor is inappropriate and maybe it doesn't require medical attention. And, there's also a lot of cultures where they believe in traditional forms of healing. And so they may not feel like, I need to express this to my family physician and maybe I don't need therapy. Maybe they don't believe in therapy at all. Maybe they don't understand what therapy is. And for them, they're going to take more of a traditional aspect. So again, I think like education kind of plays a role here with respect to how those primary healthcare providers are providing their service and what it is that they're recognizing and what it is that they're able to contribute here.
Absolutely. Jesse, yeah, go ahead.
I think being proactive really for healthcare providers and when my son was born and I had my 6-month visit with my OB, nothing was mentioned to me about postpartum. So postpartum health, how to ask how I'm doing, but then the same thing sort of once I went to my family physician, it was looked at in so much detail. She knew what my family background was. She knew what my living situation was, and she really dug deep and then eventually said, okay, you need to go back and see your OB again. You need to do this and this. So I think really for healthcare providers to really be proactive and just try to understand what their clientele and patients are really like and see what they really need and just go the extra step.
Mm-hmm. Samiyah, go ahead.
I think educating yourself is really important. As mental health clinicians, therapists, counselors, psychiatrists, etc., you really have to, it's a constant self-development, right? We have to check our biases, we have to check our stereotypes, educating ourselves, doing the research. We shouldn't be expecting our clients to provide that info or educating us on that, right? We've often heard many clients go through counseling where they're like, I had to teach my therapist what this and this meant in my culture, or how I practice my religion. And it really takes away from the therapy itself. So educating yourself, I would say, is really important. Doing the research, kind of what Jesse was saying as well. I think those are really key important things to do.
Nereah, go ahead.
And to add to what Samiyah was saying, I think, it is important to educate ourselves, but I feel like it's also important to almost leave a bit of mystery. Like I know, especially with clients I have who are Black women, I say, we share these two specific characteristics, but your experience of being a Black woman and my experience about being a Black woman may be completely, entirely different. And you may have to actually teach me about what you've been through, because I don't want to blindly assume that we've been through the same things based on these characteristics that we share. So maybe leaving that open-ended nature to it I find has been wonderful in work with clients. But I think in terms of assessment, I think that piece I mentioned prior about the racial traumas is very important, kind of understanding experiences surrounding racism, discrimination, hate crimes, etc., that maybe can contribute to some of these symptoms of mental health concerns manifesting. But in terms of treatment, I feel like treatment it may look very different for a lot of different people. I know, especially with some Indigenous clients I've worked with, there's a greater emphasis on trust building. So engaging in ways that I think for everyone, respecting their autonomy, dignity as a human being, and et cetera. But there's a piece surrounding, I want to know you a little more as my therapist.
Mm-hmm.
So engaging with them looks a little different. Sometimes it may include a bit more self-disclosure, or a little more, honesty, or a lot more humor. So even in the ways of engaging with people, that looks quite different. But also, I think the important part of treatment itself is that the client has to be involved in that conversation surrounding what healing looks like for them. Some people do heal on a very individual level. Other people need healing on a community level. And you as a therapist have to get a sense of like, okay, in this person's context, what does healing for them look like? And what can I do with the resources I know exist for them? How can I guess, bring that as part of, or incorporate that as part of the therapy? And I think that's part of the advocating piece Samiyah was talking about. It's a lot more work to be like a therapist than people would think. Like, oh, geez.
It's tough. It is tough. It's, and even considering, like, these are like, Nereah, when you were speaking, I'm like, these are all strategies that you have to take into account when you're, when you're having these conversations with your clients, and understanding that it might not just be like black and white, right? It has to move past that. Like, we have to take into account the varying cultural aspects that exist in a person. So thank you. Yeah, it is complicated, and and I appreciate all of the hard work you all do. Did anyone else want to chime into this question? Samiyah, yeah, go ahead.
I just want to add to it. You just said, Nereah, the idea of healing and how it's so different for different people, and how healing can sometimes not necessarily happen in therapy as a one-on-one with the counselor, but it can happen in community, and how we can help facilitate that for the client is really powerful. Right. So it's really, I agree with there's a flexibility there. There has to be curiosity and flexibility on your end to not just be, focused on it's going to happen here in session. It may not, right? It might be more community based, and our job maybe is just to help facilitate that for the client.
Okay, great. Any other responses? No? Okay, so I'll move on to the next question. And this is actually our final question for our panelists today. How can organizations support the mental health of BIPOC employees? Oh no, Samiyah. Yes, go for it.
A lot to say about this. No, I'm just kidding. I think that one of the really main parts is to acknowledge in organizations when the culture in the organization is toxic or there is a problem. I think that we need to start there. Oftentimes it's even hard to just get there. Yeah. Where it's a lot of dismissing, no, it doesn't exist, no, we're doing this, or we've already, we've talked about it in one meeting the whole year, right? So I think that being able to admit and acknowledge that this is something that needs to change, and creating steps that are leading towards tangible changes, and not just things that you see on paper where, we have it written in contract, this is what it looks like, but on the ground it looks completely different.
Oh, that's such a good point, because a lot of the times it's just like a check mark, right? Like, oh, we did our annual discussion on mental health, or a course on mental health, but really there's a lot more to it. And especially when it comes to BIPOC communities and employees. So absolutely. Jessie, go ahead.
Offering employee wellness programs, really, and talking about them, because sometimes you have an organization that has these things, but yet it's not available to the employees because it's not talked about, it's not made aware of. And so employees have somewhere to go, say if they're having some difficulties within their work environment or at home, where they can speak to a third person. it's through work, having a program like that, and even like having maybe once a month, especially now during the pandemic, a team meeting where you're just focusing on mental health. You're doing like a meditation, you're doing a workout, or you're just having an open conversation in terms of how you've been feeling, and really understanding as someone in a leadership position or in a senior role at an organization, so they can act as sort of mentors, knowing that their mental well-being is important. The employees' mental well-being is important to make sure everyone's sort of on feeling okay and on the same page. I think that really helps, because otherwise it's very easy to get burnt out, especially for those of us who work in very high stress organizations.
And especially, like you said, like right now during a pandemic when there's so much uncertainty. So absolutely. Nereah, go ahead.
I think I wrote a bit of notes. I feel like this is a pretty heavy question, because I feel like sometimes things are so set when it comes to organizations, and change is something that comes very, very gradually, and sometimes not at the pace that we wish it would happen. I think one of the biggest things, just hearing clients' experiences, is that not forcing conversations surrounding race. Some people are not comfortable to do that within the workplace. And I feel like some companies do this kind of like really self-promoting, like, we're progressive, like type thing. So they love to use certain like labels just to seem like inclusive, or like they're diversifying kind of like their workplace. And I feel like that if you're not ready to have those uncomfortable conversations, just like remove all those labels from like your employee meetings and your self-promotion and stuff like that, because these are quite difficult conversations to have, especially hearing about clients who sometimes they are the only colored person on their entire team, and it's hard to have those conversations. But I think companies and organizations need to really sit and think about, what is wellness? Like, what is work-life balance? How is a person who is from a different community, how are they going to be impacted when it comes to teamwork? Will they ever feel kind of isolated because there's nobody else on their team that looks like them? Like, there are huge conversations surrounding that I feel like a lot of people are not really ready to have, even though they may seem like they're ready to have them. So I think that is where that, and again, this is more of like my very ambitious self thinking of like, collaboration can get us to these places, especially with, HR teams, and understanding, because usually people go through HR when they're having trouble with colleagues or with their managers, or they feel like they're not being treated fairly. So though my mind doesn't necessarily know like what that would look like, I feel like there's a lot of potential in that realm, because I know that the workplace is somewhere where people face a lot of difficulty.
Yeah. No, those are all amazing points. Thank you for that. Yes, Anna, go ahead.
I just wanted to add, so some of my clients, particularly some of the challenges that they faced with respect to the employee assistance program, they've kind of mentioned how there's not culturally competent therapists available when they do get into the program finally, and secondly, the criteria around it. So a lot of my clients have told me, like, we'll sit with HR and we'll sit with our bosses and explain to them the racial trauma we're experiencing or the racism. Because there's no understanding on the other end, they're dismissed. And so they're told that, well, sorry, you don't fit this criteria. But then their coworker who might be experiencing, say, anxiety or something else, they fill out that same form, they have that same conversation, and they're given a therapist and they're given time off. They're given disability leave. And then another issue that a lot of my clients have told me is insurance companies dictating the number of sessions for therapy that they're willing to either provide coverage for, without understanding and without even being willing to accept that hey, so-and-so actually has a lot more complex issues to deal with, and we need a little bit more time here. So those have been two of the concerns that are brought to my attention by clients. And I too have faced with that with respect to even dealing with insurance companies. It's very difficult you walk a very fine ground in not disclosing too much about the client, but also asking for a little bit more help on their end, to be a little bit more accepting and understanding and willing to cooperate and offer that extra number of sessions here and there. And I'm sure, as you guys know, like in therapy, it's impossible to help someone from 1 to 4 sessions. Like if you're going to cover 4 sessions, you may as well not come. It's so difficult to do that. So I feel like there needs to be a little bit more understanding from their ends when it comes to matters like this.
Yeah, thank you for that. That was a very loaded question, and but you know what? It's everything that you have all said has really it's hit it bang on. Like these are the changes that need to come. These are the collaborations, like Nereah mentioned, that need to come and need to happen. And in order for all of this to happen, it has to be like, we have to start it through these conversations and recognizing that there is a need to do more in this realm. So thank you all for providing your insightful perspectives on all of these questions. Every question has just been so good. So that concludes kind of like the formal question period for this panel. And I do want to offer anyone who is virtually tuned in right now, if you have any questions, feel free to use the chat box, or you can unmute yourself and or even show yourself on camera too, and feel free to ask any of our panelists any questions that you may have. We might have a quiet group today. Okay, well, I don't have any more questions. If any of our panelists have any kind of closing words that they'd like to add, please feel free to do so. So I'm going to put you on the spot now, and I know this wasn't in in the plan, but Sana, any final words you'd like to share with everyone today?
Yeah, I guess just thank you so much for like having this discussion. I feel like this is a start to so many great conversations. I'm so happy to have met some of the other panelists. I've taken time to like connect with them. I always feel like personally as a therapist, if I feel like I'm not a good fit for a client, it's great to have different therapists sort of connected to me that I can easily refer out. And yeah, it was a pleasure talking to you ladies.
Awesome, thanks, Sana. Jessie?
Yeah, just thank you, everyone. This was a much needed discussion, and I think we covered some really important topics. Having conversations like this is what's going to break the stigma, is what's going to help us really be more comfortable about talking about mental health. And I think, yeah, we just continue to raise more awareness, do things like this within our own bubbles, and slowly it's going to have the trickle effect, and everyone will be doing it. So thank you once again. It was a pleasure having this conversation with you ladies.
Hey, thank you, Jessie. Nereah?
I just wanted to say thank you for allowing me to be a part of this. I think, like everyone has said, it's a very important conversation, and I feel like this is one of many conversations surrounding just everything we've spoken about. And I really, am hoping to see this being taken on like somehow maybe being taken on a bigger level, or on a community level, a societal level. And I feel like there's a lot of work to do, but it's organizations like the Lotus Movement and Women of Color Remake Wellness that the fact that you're even opening up this conversation is huge and very great and amazing work. So yeah, thank you.
Thank you. Just a bunch of thank yous everywhere. Samiyah?
Well, I mean, there's a lot of thank yous for sure. So I'm just going to echo what everybody had said. I think that I really appreciate the platform. I think one of the things that when I first started doing psychotherapy and working in different organizations, I really had a hard time connecting with other communities that may be experiencing similar things. And so the fact that I see, so many different professionals on the panelists that are having these conversations, I'm like, yay, it's happening, which is great. So I think that we've touched the surface of a lot of these topics. There's so much more levels, and thank you so much for inviting me. It was really helpful to hear all the conversations that was going on today, and hopefully we'll be able to meet outside and also inside, or the virtual world. But it was such a pleasure getting to know all of you ladies, and we'll connect.
Yes, for sure. Beatrice, did you want to add anything? Any
I think the words of public speaking, but yeah, I'm just gonna echo what everyone said. Basically, thank you so much for agreeing to also be a panelist. I think that's really important, and I'm so happy that we do have a diverse group of panelists who have different backgrounds. So you guys are able to bring different experience to the conversation, which is so important, because again, just the idea of like Nereah said, it's the fact that just because you're Black doesn't mean like we have the same experience. Our experience is going to be completely different. So I'm very happy that we do have a diverse group of panelists, and yeah, thank you thank you everyone for attending as well. That's really important. And yeah, I'm just gonna leave it at here. Yeah. I'll let you have the last word, I guess.
Well, I'm just going to echo what everyone just said right now. No, but honestly, I think this is the right direction to get this conversation going. And like I think it was Samiyah that said, this is just touching the surface. So there's so much more that we need to dive into, and we need to have open dialogue when it comes to mental health and BIPOC community. So hopefully look out for more of these sessions and these panel style events. I think this was it was so good. I learned a lot. So thank you to all of our panelists again for taking the time today to educate all of us. This was a beautiful session. I want to thank Women of Color Remake Wellness for teaming up with the Lotus Movement to put on this event today. I hope we can do more for our communities in the future. And to all of our attendees, thank you for taking the time this evening to participate. Like Beatrice mentioned, it is recorded and it will be shared on the YouTube channel and the website as well. So definitely, if you want to refer back to it, or if you even want to share it with some of your friends as well, please do. And we will catch you all next time. Thank you, everyone. Have a good night.
Bye.
Bye.